An area that's always of concern is the delivery of health services and the security of healthcare in rural areas. On a number of levels. I mean, people are worried as to whether our nation will have the ability or desire to sustain a publicly funded, publicly administered healthcare service in Canada. When we look at the expenditures that Harper is considering to make in the military, the tax giveaway to large corporations, and in his budget he talks about 4 or 5 years in reduction of debt and deficits, but nowhere does he talk about investment in healthcare. The agreement with the provincial governments and the federal government, that $42 billion healthcare agreement that has been negotiated by Paul Martin, is almost over, and it's time to renegotiate that. Part of that agreement was 6% above cost of living increase to the provinces, transfer to the provinces, so that they can deliver the healthcare services that we need. That hasn't been budgeted by Mr. Harper. It's either he's planning to do away or limit the amount of public healthcare available, or he's completely misleading Canadians. I don't know which is which, but it makes me nervous. What we want to do is we want to make sure that we have a growing healthcare system, publicly administered, publicly funded, to all the regions of the country. What we have fear of in Western Nova Scotia is attracting medical professionals. So we have to deal with that. And what we're talking about is having an incentive for graduating medical students, for graduating nursing students and other health professionals to go into underserved areas. We'll help them with the student debt. They also carry large amounts of student debt. We'll reduce up to $40,000 of student debt for a doctor that wants to go practice in an underserved area, as long as he commits or he or she commits for a number of years. I think that will go a long way. We see some communities have taken great strides in attracting medical professionals, of creating the facilities. This will work hand in hand with the communities and the provinces at that level.